Hello, my name is Octavia Ingram, and my presentation will cover mindfulness-based cognitive therapy. What is mindfulness-based cognitive therapy? It is a group therapy that consists of 8 weekly sessions. They're 2.5 hours long. There's also a 6-hour silent day. The sessions consist of meditation and cognitive behavioral therapy. Negative thoughts are allowed to increase patient awareness of maladaptive thought processes. Mbct focuses on the process of thinking, while cognitive behavioral therapy focuses on content-informed thoughts. The PICO question is, in patients with depression, does Mbct compared to lack of Mbct improve patient outcomes? The PICO elements for the P, which is going to be the population, is going to be all individuals diagnosed with depression. The I, which is the intervention, is going to be the mindfulness-based cognitive therapy. The comparison group is the lack of mindfulness-based cognitive therapy. And the outcome is going to be remission, reduced depressed episodes, improved mood, and to improve quality of life. The search strategy, the keywords used were mindfulness-based cognitive therapy, mindfulness-based interventions, cognitive-based therapy, depression, prevalence of depression, pharmacological intervention, depression treatment plan, depression standard of care. The search engines were the Cumulative Index of Nursing and Allied Health, literature, PubMed, and Medline. Scope of the problem. Depression rates affect 300 million individuals globally. Disability. Major depressive disorder is the leading cause of disability in ages 15 to 44. Productivity loss. Productivity loss alone costs U.S. employers $23 billion per year. Dual diagnosis. Dual diagnosis is a term given when a patient experiences a mental illness and a substance use disorder simultaneously. 7.9 million experience a dual diagnosis. 4.1 million are men. Based upon the literature review, the first study conducted in England, it was to measure the effect of Mbct in the treatment of depression in real-world healthcare clinics, and it found that Mbct significantly reduced current symptoms of depression. Another study revealed mindfulness meditation was shown to improve physiological well-being and increase gray matter in areas of the brain. Another study examined the maintenance dosed antidepressants and Mbct, and it showed equivalent success in the management of depression. A behavioral measure, breath counting, was used to examine mindfulness and found it positively correlated with mindfulness and is an effective treatment measure for depression. In a study conducted at the University of California at San Francisco, Mbct was shown to significantly reduce the symptoms in treatment-resistant depression. In another study, Mbct improved remission rates, quality of life, self-compassion, mindfulness skills in chronically depressed patients. The recommendations from the authors were that Mbct should be used in acute episodes of depression as well as relapse. Mbct is also an effective treatment for patients using antidepressants and for those who seek alternative treatment measures. Mindfulness is an effective treatment for depression as well as attention deficit hyperactivity disorder. Implications for practice. Healthcare professionals need training on Mbct as it is necessary to offer patients an alternative option to pharmacotherapy. Teacher competency must be established to properly lead Mbct sessions. Patient compliance with weekly sessions will significantly affect the effectiveness of Mbct, and continued use beyond one trial may be most beneficial. Clinicians must be knowledgeable in the acute and maintenance phases of depression. Future study. Future study will involve long-term preventative effects of Mbct, studies that address quality of life and not only symptomology, Studies that use behavioral measures to assess mindfulness, and rumination to provide more insight to clinicians when developing a treatment plan. For any questions on this presentation, I can be reached at octavia.ingram01@utrgv.edu. Thank you.